Good morning. My name is Dr Marie-Therese McKenna. I am a GP and I am voting no. When a woman presents to a GP, the GP has a duty of care to her. When a pregnant woman presents to the GP, the duty of care is to two patients, both the mother and the baby. The primary principle governing medical ethics, to first do no harm, therefore applies to both patients. The second is to provide care according to the best medical evidence. If the 8th Amendment is repealed in the upcoming referendum, the government will legislate on the termination of pregnancy in this country. Termination is defined as a medical procedure intended to end the life of a fetus. By definition, the intentional direct ending of another human being's life is not health care. The legislation goes on to outline the proposal for unrestricted abortion up to 12 weeks. Minister Harris has proposed, without any consultation with GPs, that this would be a GP-led service. This would mean that a healthy woman with a healthy baby could go to her local GP and ask for a lethal drug to be prescribed. The legislation gives her the right to that drug, whether or not the doctor thinks it's a good idea for her. In no other area of medicine does the law ask a doctor to suspend clinical judgment and simply do as the patient asks. These abortion pills are not licensed in other countries beyond 10 weeks. Mr Varadkar has stated that GPs providing this service would need to confirm the gestation of the pregnancy. This is usually done by ultrasound, but GPs currently do not have direct access to ultrasound within the time frame required. GPs do not have the expertise or training to correctly assess gestation by ultrasound, and it's a specialised area that's currently not part of normal GP practice. Yes campaigners raise concerns about the number of women ordering illegal pills online. It has been suggested that legalising abortion pills will be safer for women. In the UK, 190,406 abortions were carried out in 2016. The number of abortion pills being obtained illegally online was described in the same year by the British Pregnancy Advisory Service as staggering. Any medication whose sole purpose is to end human life is, by definition, unsafe. Until we offer real support to women in crisis pregnancies, we will never resolve this problem. If GPs are forced to offer abortion up to 12 weeks, it will fundamentally affect the doctor-patient relationship. Legalising abortion normalises it. If you normalise something, it becomes more common. This has been the experience in every other country which has good statistical data. It is disempowering to women to suggest that rather than encouraging them to give life to their baby, their best option is to end their baby's life. Abortion is presented as health care. Abortion, by its definition, can never be health care. It does not heal, it does not restore, it hurts both the mother and her baby. Many women who have had an abortion feel deep sadness and regret, maybe not initially, but often later in life. We see this in our GP surgeries and are perhaps more aware of it than our obstetrics colleagues and other healthcare professionals. In this debate, those advocating for abortion speak of the fetus. This distances us from the reality that what we are talking about are babies, and the reality of abortion is that it ends the lives of babies. Doctors are being told that if the 8th Amendment is repealed, we will have the right to conscientious objection. The Heads of Bill outlines the terms of this and specifically states that a doctor must refer to a colleague who is willing to perform the abortion. This cannot be described as true conscientious objection, as the doctor is directly involved in organising the abortion. There is already a serious manpower crisis in general practice. Many rural posts are vacant or very difficult to fill. Many of our future doctors will self-select out of general practice as a specialty because of their reluctance to be involved either directly or indirectly in the provision of abortion. Under the current proposal, Many practicing GPs will find it very difficult, if not impossible, to reconcile their responsibility to first do no harm with the inadequate arrangements for conscientious objection. GPs nearing retirement will feel demoralised and marginalised, while younger GPs may move into different specialties. All these factors can lead only to further pressure on an already overstretched and under-resourced general practice, and it will be our patients who will suffer as a result of this. The Eighth Amendment currently provides the only legal protection for the unborn, as confirmed in the recent Supreme Court ruling. We will have no control over what future governments, or even our current government, will introduce if we repeal the Eighth. General practitioners are on the front line in dealing with crisis pregnancies, especially in the first 12 weeks. Women do not choose abortion lightly. It is seen as a last resort. We call on the government to grant adequate resources so that we, as their doctors, can offer women proper support and assistance that does not involve pitting the rights of the mother against the rights of her unborn baby. Abortion hurts women, it hurts babies, it hurts families. I urge people to vote no so we can find a better way. Thank you.